Yes, well, Dr. Chris Smith is a consultant virologist at Cambridge University and the host of the Naked Scientist podcast. Good stuff. It is pre-watershed, Chris, so, keep it family-friendly. But, look, what do you think, ultimately, about the potential for us to reduce this 10-day isolation period, potentially, down to 5? There's noises growing, aren't there? Of course, Boris declined to do that yesterday.
The reason that we've got the numbers that we do in terms of isolation periods and so on is because of the incubation period of the infection. This virus has a very long incubation period for some, 2 weeks, but on average, it's about 5 days. And so if you were to say to people, stay off for only 5 days, you'd actually be hitting the peak of the average incubation period. Now, the confusion probably has arisen from other countries and their practices, because in America, for example, they have been using 5 days, but they start the clock ticking at a different point than we do. Here in the UK, we say from the time at which your symptoms first appeared or you got a positive test, that's day 0, start the clock. Whereas in America, for example, they wouldn't start the clock until that positive PCR test flapped down on your doormat and you were told you've got coronavirus. And by then, of course, a number of days have already gone by. You've got symptoms, you have got a test, you've got the test result. That means that you're already quite a long way down the track before you get your diagnosis. So we're not really comparing apples with apples when we say, well, some countries are saying 5 days, some are saying 6 or 7. So what our scientists said was, well, we know what the incubation period on average is, about 5 days. If you follow the infectivity, how likely a person is to pass on the infection once they've definitely got coronavirus, it increases up to about 5 days. Then the symptoms kick in, and then a person, if they're going to get any symptoms, very quickly drops their infectivity. And so if you wait 4 or 5 days, you're probably hitting the peak infectivity, but if you wait for 6 or 7 days, and by then you've got negative lateral flow tests, the likelihood of you passing it on is much, much lower, much, much safer. And it's on that basis that they said we feel comfortable with 6 or 7 days, not with 5.